Hello and welcome back to the next lecture in our pathology lecture series. I am Dr. Srikumar, Professor of Pathology at MAHSA University, Malaysia. In our previous few lectures, we've actually seen about cell injury and the various aspects of cell injury, which is apoptosis and necrosis. And we've also seen that necrosis is of a few types, which is coagulative, liquefactive, gangrene, caseous, and fat necrosis. Now, when necrosis occurs in the body, our body responds by the process of inflammation, which is what we're going to see here today. Now, in the first session today, we are actually going to discuss about acute inflammation. But one point we need to note is that an acute inflammation is a response of the body. Now, it responds when the cell gets injured. So what does this mean? This means that our body has an inherent capacity to heal. We don't need doctors. The role of a doctor or a physician is just to assist. At any point in time in our body, we are having numerous inflammatory processes, which is a way in which our body is responding to any disease or any insult. So remember, nature heals. Our role is just to assist as a doctor. So now this phenomenon of inflammation was described as early as 3000 BC, 5000 years ago by the Egyptians in their papyruses. When we actually go through the papyruses in archaeological digs, we realize that the pharaohs were treated for inflammation by their high priests. And later on, this gentleman here, Cornelius Celsius, at about 27 to 30 AD, described the hallmarks of inflammation. And later on, in 1793, this gentleman here, John Hunter, a Scottish surgeon, explained that inflammation is not a disease. Until then, it was thought that inflammation is a disease. But he explained that inflammation is not a disease, but a salutary response to an injury or an insult. So until then, when we had a process of inflammation, we thought it was a disease. But now we realize that inflammation is the way in which we respond to a damage in the body. Now, I say this again and again because this is a message that has to be driven home. Now, later on, we've had a lot of significant contributions from Julius Conheim, who was the first one to observe vascular changes in inflammation under a microscope. And later on, Elie Mechnikov, who postulated and showed that phagocytosis is one of the important aspects in inflammation. Phagocytosis by macrophages. This is an aspect which I'll probably discuss a couple of lectures after today. And Paul Ehrlich found out that plasma and serum factors play an important role among the various chemical mediators in inflammation. Later in 1908, he won the Nobel Prize for his discoveries. So with this brief history on inflammation, let us actually go into what is the process of inflammation. I'm going to take you through what is inflammation and then the vascular and cellular events in acute inflammation. And these are the lecture objectives in the session today. Now let's have a look at this picture on the right side. You actually have a soldier who's shooting bullets from a gun. This is one of my favorite PS4 video games. Now, a soldier shoots his gun, shoots his bullets when he is attacked, or when the country is attacked, or when your zone is attacked. The same way, when our body is attacked by an injurious stimulus, for example, a bacteria, our body responds and we try to protect ourselves. So the first step in inflammation, we protect ourselves against an injury or an insult. So when we protect ourselves, we try to remove the cause of cell injury. And also, we remove the necrotic cells that occur during the injury. For example, during a fight, when the enemies attack you, and they shoot bullets all over the place, and some of the buildings or walls come crumbling down around the battlefield. So as a soldier, when we fight the enemies, we not only kill them, but we also remove their dead bodies, and we also remove all the material that has crumbled, the walls that have crumbled around. The street has to be cleared. The same thing in the body. When we fight against the bacteria, the dead bacteria have to be removed. The infected cells which hold the dead bacteria have to be removed as well. And at the same time, we make sure that we have protected the body. Now, the extent of injury depends on the extent of the agent that causes the injury. For example, if the bacteria is highly virulent and causes a great amount of infection in the body, the inflammatory response also is increased in intensity, severity, and duration. Now, there's a lot of difference between a pinprick, where you have a small swelling at the tip of your fingers, to a large road traffic accident where a larger amount, a chunk of tissue is damaged, and that requires a greater inflammatory response in the body. So the response varies depending on the injury that has occurred in the body. Okay, so let's do this in simple words. In simpler words, inflammation means setting fire. It's like a dragon that breathes out fire. You set fire to the body. Why is it that when our body is inflamed, when we have an infection, we develop a fever? The body is inflamed, set into fire, because our various processes in the body are switched on, by which the blood vessels respond. So this is a response of the vascularized tissue to injury. And this is not just an ordinary response. This is a dynamic response, dynamic, very active response. So remember, as what we saw in the previous slide, it is a protective response. It eliminates the bacteria, and it makes sure that our defense and healing mechanisms of the body are brought to the site of injury. So it is like traveling in a train and suddenly you have robbers who have surrounded you. You have a dynamic response, you fight back. At the same time, you defend yourself, and at the same time, you try to heal the wounds that have occurred during the fight. The same thing happens in the body. Our body is like a railway, like multiple trains running all over, and each train or each blood vessel is experiencing some amount of inflammation or the other at any point in time. And this is a process which is happening without our knowledge, because it is an inbuilt mechanism by which the nature heals, as I told you in the first slide.